back to balance time. Mr. Price is recognized.
Thank you, Mr. Chairman. And Chairman mentioned that we ought to have a sense of humor in these activities. We'd have a sense of humor if this weren't so serious in terms of the consequences to the American people. My friend from New Jersey said, "Where's your plan?" And I would just echo the comments of my colleague from Illinois, who said, we'd love to have worked with you on this plan, but there wasn't any opportunity to do that. You know that. Speaker didn't allow for that. In fact, Speaker Pelosi told members of your conference that if you talk with Republicans about this, you will be shut out of the room.
Gentleman knows that's not true. The gentleman absolutely knows that's not true. Why did we sit down with the members of this committee when we first put the draft up and walk you through it?
I'll be pleased to provide the quote for you from the member from your conference. I don't have it with me right now, but I'll be pleased to do so. You know that this hasn't been a bipartisan effort. You know that. The members on this side of the aisle have been attempting to work productively, positively on this issue.
Good.
As a physician for over 25 years, I cared for patients who bristled at the notion that the federal government ought to be involved in their health care. And what you all are planning is to increase drastically the intrusion of the federal government into the practice of medicine and the care of patients.
You guys need to tell them.
You talk about what your plan does. I'll tell you what your plan does. It increases the size of government, it increases the intrusion of government, it increases the taxes on virtually every single American, kills jobs, will destroy health care in this nation. And you stand over there proudly trumpeting this plan that we got this morning. This plan. You ought to be ashamed. The principles of health care in this nation that Americans describe, not one of them are improved by the intrusion of the federal government. Not one of them will be improved by this bill. You talk about accessibility. You're going to give 97% of the American people access to health care. You know what they'll have access to? They'll have access to an opportunity to get in line. They'll be able to get in line. Mr. Chairman, that's not what the American people want. Physicians across this land will be exiting the practice of medicine because of this bill. Medicare patients right now, new Medicare patients across this land can't find a Medicare doctor because of the provisions that are included in this bill. You talk about affordability, a $1 trillion-plus bill. American people have no desire to have this kind of burden placed upon themselves, their children, and their grandchildren. You talk about quality. Where in this bill does it allow physicians and the folks providing the care the opportunity to define quality? It doesn't. You've got a couple new boards. You know, this grand scheme here, one of these blue dots or yellow dots or red dots has a new board or two that defines quality. You want that for your kids and your grandkids? Mr. Chairman, there's a way to solve this challenge that we have, and it's a way that respects the American people. It's a way that respects the positive aspects of our current program and improves upon those that have resulted in the challenges that we have, with 45 million folks episodically uninsured at some point over the last year. We've got a solution for that. We've talked about that solution. I've talked with many folks on the other side of the aisle about it. It's a solution that doesn't involve turning the entire system upside down on its head. It's a solution that respects people, respects the right of free individuals to make free decisions without a 1,000-page monstrosity that will remove from them and their families the opportunity to make the most personal health care decisions. This is not an improvement. 24 hours to look at a bill. We're going to ram through this stuff today. Look at the amendments on the table in front of us, Mr. Chairman. Don't you think each of those amendments are heartfelt by the individuals proposing them? Same on the other side. Shouldn't we have appropriate amount of time to review those amendments on consequential decisions for the American people about personal health care? Mr. Chairman, I look forward to working in a bipartisan way to truly solve this problem. I hope that my friends on the other side of the aisle will have a change of heart and move forward positively instead of this charade that will destroy health care in America. I yield back.